We are in St. Petersburg, Florida, in the office of Dr. Cesar Lara, whose innovative system has helped thousands of patients shed their excess weight and discover the joy of living in a state of health and balance.
How was your journey this time?
Good. Thank you for having us, Dr. Lara.
Thank you. It's a pleasure and an honor to be here.
Well, why don't you tell us a little bit about your background?
Being a physician or a doctor was something that I always played with, dreamed about, and always wanted to be. And as time progressed, I eventually was able to get into college, medical school, residency, and eventually I started my career as a family physician.
He loved everything about being a family physician and enjoyed seeing patients of all ages, from delivering babies to helping the elderly.
I began to recognize that I was really not helping transform them into a healthier individuals, but I was really helping them become more dependent on medications and therapies that were not really helping them cure the disease,
Sure.
but were only helping them maintain that consistency of being sick all the time.
Dr. Lara realized that there had to be a way to empower them instead of just treating them. You've created a pyramid of health?
Yes.
Is that correct?
So in my philosophical way of looking at health, the pyramid of health represents at the baseline is the nutrition.
Food can be good medicine. Eating the right things make you feel better, lose weight, and even cure some illnesses. However, eating the wrong things can be toxic.
Is there anything you can share about nutrition that we should all add to our diets or remove from our diets so we can have that healthier foundation?
The reality is that if we go back to a more earth-based nutrition plan, so if we actually eat from the green of the plants, if we actually eat the fruits and everything that comes from the earth, and we complement that by being able to respect those animals that can provide for us a livelihood by being able to make sure that they were fed and they live good lives. And we actually, as we take their nutrients into our bodies, we also are taking their energies.
Studies have shown that synthetic sugars in a prolonged diet of commercialized foods can greatly affect the limbic system of the brain.
And our limbic brain system is really a more ancient brain that makes us fearful, that makes us feel like we don't have enough, make us feel like something's wrong with us. In other words, it's a more intuitively flight or fight kind of a mentality.
When we have a more natural diet, it can benefit the neocortex part of the brain, which controls high-order functions like sensory perception, cognition, and spatial reasoning.
Neocortex allows us to see things that are more clearly around us, but sometimes we don't really see. We are actually awaken our intuition and awaken our ability to communicate the brain with ourselves so it can make us healthier.
Just by eating better?
Just by eating better.
Now, I know when I've traveled to other countries, they don't use things like GMOs, which is a big problem here in the United States. So I would assume that you have to look for those nature-based foods, but without the chemicals being on them that can just wreak havoc on your microbiome.
The two things that you mentioned is one, the microbiome, which is extremely important,
Yes.
and that's really understanding what is considered to be our second brain. And then the second part that you mentioned is the toxicities.
Obesity, diabetes, and heart disease are a response to an inflammatory condition which comes from dysfunctional cells in the body caused by toxins in our food.
Even the water that comes in plastic bottles, we're actually getting ourselves toxic from all the waste products that are inside those bottles. You see, we're not one organism by itself. We're an
Correct.
organism made of billions of other organisms, so
Yes.
we're a community. And so as we feed ourselves the right food, we're actually helping improve the health of our other sisters that are our bacteria. And with good bacteria, we can actually absorb the nutrients much effectively and convert them to the nutrients that your body needs to optimize and heal itself.
There's so much to this, and which brings me to the next part of the pyramid. And I believe it's at the top, if I'm not mistaken, but lifestyle change.
With the lifestyle, we're looking at stress.
Okay.
We're looking at how are we being affected by all these different aspects around us. If I hang around with somebody that is very toxic to me and I get reactive and I get frustrated
Yes.
or I'm not at peace with myself, I'm not at peace with my spouse, I'm not at peace with my children, I'm not at peace with work, that's affecting me. That's turning on one of the adrenal glands that is actually producing cortisol.
This puts us into fight or flight mode, where the body sends all its energies into the limbs, so we can literally run as fast as we can or fight whatever may harm us. This takes the energy away from the creative mode, which promotes healing and good health.
And it's that perspective of being continually under stressful situations that is responsible for causing the majority of diseases that we have, because we're not allowing our body to heal itself. We don't sleep right. We don't eat right. We're not exercising.
Exactly.
We're not drinking enough fluids. And an interesting aspect is when you think in terms of genetics, genetically you're predisposed to heart disease. Genetically you're predisposed to breast cancer. Missing in that part of it is that we may have a program in our bodies. It's only whether you turn on that program or you turn that off that actually creates the reality of a disease or not.
We now know that over 500 different genes can be turned on to give us longevity and good health, and nearly 200 genes that formulate disease can be turned off, all by simply watching what we eat.
It's something I think about as I age, but hormone replacement therapy. Now, you have something called bioidentical hormone replacement therapy. What is that, and how is it different from what's already on the market?
To give you a little bit of background, so as we age, our levels of hormones begin to decrease slowly.
Sure.
And so it's not uncommon to know that an 80-year-old person, if you test their hormones, they're going to basically be extremely, extremely low, if they're at all.
Double-blind studies conducted by major hospitals and universities prove that if doctors supplement the decline with hormones identical to the ones the body produces, they can prevent the risk of diseases caused by aging.
So for example, in a male, the primary therapy is usually testosterone. Mm-hmm. So the testosterone levels in a male may be 300 or 400, which are categorically felt to be normal. But a male doesn't feel as healthy and begins to have symptomatology, and that can be actually resolved if we get them to levels that are more optimal, say around 800. So that's still in the normal range.
Okay.
And yes, his body may not be able to make as much, but he wasn't making as much to begin with, which is why you're supporting it.
Dr. Lara utilizes many tools for treating his patients, from the oldest Eastern methods of healing the mind to the newest Western techniques of healing the body. One of the newest techniques is his laser therapy.
So why don't you explain what Verjus is?
So Verjus is a technology that is very holistic in nature, and what it does is using green light laser therapy, it actually, without touching you, literally make little holes inside your fat cells, and your fat cells subsequently release their fatty acids, which is what fat cells are made of. Okay. And that fat energy is subsequently utilized by your body as energy source, or it gets taken out of your body through the drainage system of the body, which is called the lymphatic system.
The result is the patient losing up to 4 to 6 inches of fat from their body. We sit in while patient Alexandra Buckingham receives a Verjus treatment.
Wonderful.
Alexandra lost 80 pounds in 10 months under Dr. Lara's care.
I had 2 kids. They were really close together. I just packed on the baby weight. I was 200 pounds and I was just like, I have to get my body back. I tried a ton of diets. I've tried the keto, I've tried this, I've tried that, but this was the only diet that seemed to really work and keep the weight off.
Dr. Lara's diet includes eating small meals throughout the day and incorporating lots of protein to prevent hunger.
You achieve your goal and then you go back monthly to check in to make sure that you're staying on track. So that's kind of good. It's just like a new way of life. It's not a diet anymore. Dr. Lara's program is different because I feel like he looks at you as like a whole. He looks at what your body needs and like your levels, and he tries to balance you, which helps you lose weight.
Dr. Lara says that his approach to healing patients is very different today than it was when he was a family doctor years ago.
You're amazing.
Mm-hmm. Okay. Thank you.
Today, when you come to me and you have a condition, or a label,
right.
I realize the importance of stories. That if somebody has a story about being sick all the time, mm-hmm. and that's all they talk about, it's very difficult for them to get outside of that story, and they continue to call upon themselves more illnesses. So my approach right now is really to look at you, no matter what you present yourself with, is to see the beauty and to see the love and to see the energy within you that can actually give you the life and the joy that you want.
You're so into wanting to treat the mind, body, and soul. You got into shamanism.
The most important thing about that aspect of therapy is that it deals with energy.
Understanding ancient historical wisdoms allows Dr. Lara to help his patients harness their own power in a more comprehensive and impactful way.
Thank you so much for helping treat the whole person instead of just a label that was placed on them.
Thank you. It's been my honor to be able to share with you some of my philosophy and Of course, my intention is to make the world a better place, one person at a time.
Oh, well, bless you, Dr. Lara.
Thank you.